Okay. Today we are discussing about the second part of diseases of blood. The first question is virus responsible for the infectious mononucleosis. Okay, so the virus responsible for infectious mononucleosis is Epstein-Barr virus. Next, the oral manifestations of infectious mononucleosis most commonly there will be pinpoint petechiae on the palate. So this is a characteristic of infectious mononucleosis, pinpoint petechiae on the palate. Next is megaloblastic anemia occurs due to folate deficiency. One of the following syndrome is characterized by an esophageal web resulting in dysphagia, atrophic changes in the mucous membranes of the mouth, and hypochromic microcytic anemia. So three or four clinical features are described. First one is esophageal web formation resulting in dysphagia, then atrophic changes in the mucous membranes of the mouth, and hypochromic microcytic anemia. So the disease is Plummer-Vinson syndrome. Next is aplastic anemia is common with which drug this aplastic anemia is common? Chloramphenicol. Then hemophilia is associated with normal bleeding time and prolonged clotting time. Okay. And the next question is, which of the following is a sex-linked disorder? There are so many options, but I am reading only the correct one. Hemophilia is a sex-linked disorder. A hair on and appearance is seen in all of the following except, so there are four options are there, thalassemia, Cooley's anemia, sickle cell anemia, and Paget's disease. These are the four options, but we can see hair on and appearance in thalassemia, sickle cell anemia, as well as in Cooley's anemia. Okay, so the correct answer is Paget's disease, in which hair on and appearance is not seen, but except that thalassemia, Cooley's anemia, and sickle cell anemia exhibit hair on and appearance. Okay, next question is, a patient on warfarin sodium following the myocardial infarction reports for an oral surgical procedure. Which one of the following laboratory tests should be performed to ascertain the fitness? So, a patient has already undergone myocardial infarction, now he wants an oral surgical procedure. Which of the following tests should be performed? That is a question. Okay, the answer is prothrombin time. Next, which one of the following is not true about thalassemia? The question is, which of the following is not true, but I am reading the correct options. That means my reading will be like, which of the following is true about thalassemia? Okay, I am saying only the true things about thalassemia. There is erythrocyte fragility and hemolysis. The first one which is true about thalassemia is there is erythrocyte fragility and hemolysis. Second one is hypochromic microcytic anemia is present and there is severe anemia and thrombocytopenia. So about thalassemia we are describing three clinical features again. First one is erythrocyte fragility and hemolysis. Okay. Next is hypochromic microcytic anemia is present. Then third one is there is severe anemia and thrombocytopenia. Severe anemia, the second option itself is about anemia and it will be severe, and thrombocytopenia will be there. Okay, that is it. Then erythroblastosis fetalis can be prevented if the mother is injected at parturition with an antibody called which is an antibody, okay, which prevent erythroblastosis fetalis, that is Rh immunoglobulin, RHD immunoglobulin. Next is deficiency of all the three components of coagulation factor 8 resulting. All the three components. So now we understand there are three components for factor 8 and deficiency of all of these three components will result in von Willebrand's disease. Okay. Cooley's anemia is also known as thalassemia. Okay. Cooley's anemia, the another name of thalassemia is Cooley's anemia. Okay. The most striking hematological finding in agranulocytosis is the most striking hematological finding in agranulocytosis is decreased absolute neutrophil count. Okay, hope you understand. The most striking hematological finding in agranulocytosis is decreased absolute neutrophil count. So the neutrophil count will be decreased. That is a first finding, hematological finding in agranulocytosis. Okay, the most common coagulation disorders, hemophilia A and von Willebrand's diseases are due to. Okay, most common coagulation disorder of hemophilia A and von Willebrand diseases are due to factor deficiency. Then above, now we can understand that factor VIII deficiency causes hemophilia A as well as von Willebrand's disease. In radionuclide imaging, the most useful radiopharmaceutical for skeletal imaging. So, a different question is a rare question. In radionuclide imaging, the most useful radiopharmaceutical for skeletal imaging is technetium 99M linked to methylene bisphosphonate, which is at technetium 99M, that is linked to methylene bisphosphonate. Okay. Now, next question is the most reliable criteria in Gustavson method of identification is, or single most important indicator for Gustavson method of age analysis is transparency of the root. Next is, which of the following blood diseases has a racial predilection? Okay, racial predilection. Which of the following blood diseases has a racial predilection? That is thalassemia. All the following are true. All of the following are true in immune thrombocytopenic purpura, which are true about immune thrombocytopenic purpura. So I have already discussed about immune thrombocytopenic purpura, and the features are chronic ITP, immune thrombocytopenic purpura, commonly occur in adult women. That is first characteristic. Then prothrombin time PT and partial thromboplastin time PTT are normal. So prothrombin time and partial thromboplastin time are normal. Then increased megakaryocyte in the bone marrow. Increased megakaryocytes will be there in the bone marrow. Next question is, Chediak-Higashi syndrome is inherited as, it is inherited as autosomal recessive form. Okay, Chediak-Higashi syndrome is inherited as autosomal recessive. Next question is, commonest mode of inheritance of von Willebrand's disease is, commonest mode of inheritance. The answer is autosomal dominant. Okay, von Willebrand disease commonly inherited in as autosomal dominant form. Okay, patient with increased prothrombin time APTT and TT and normal fibrinogen and platelet count, diagnosis is vitamin K deficiency. Okay, agent responsible for increasing factor VIII activity in hemophilia is, agent responsible for increasing the factor VIII activity, which is the agent D-amino D-arginine vasopressin. Okay, we are discussing about hemophilia condition, and the agent which is responsible for increasing factor VIII activity in hemophilia is D-amino D-arginine vasopressin. Next, a 24-year-old male complained of recurrent attacks of sore throat since 2 years. Okay, a 24-year-old male complained of recurrent attack of sore throat since 2 years. For long 2 years, he has been suffering from recurrent attacks of sore throat. The total leukocyte count was 3000. Leukocyte is very less. A differential count revealed severe neutropenia. The diagnosis is agranulocytosis. Then mycosis fungoides is a T cell lymphoma. Okay, mycosis fungoides is a T cell lymphoma. Then a deficiency of ADAMTS13 enzyme is seen in, a deficiency of ADAMTS13 enzyme is seen in thrombotic thrombocytopenic purpura. Okay, thrombotic thrombocytopenic purpura. So I will discuss all of the topics in detail as different classes, and so you listen to that classes of